Hello everyone and welcome back to my channel. For my old subscribers, I want to say a big thank you for subscribing and for watching most of my videos. For my new subscribers, I just want to say a big welcome to the community. On today's episode, I'll be speaking about a topic that is very sensitive to women and affects women. It also affects men too, even though not directly, but at least, indirectly, let me put it that way, and it is miscarriages. Yes, so today we'll be talking about miscarriages. Now, it's really a common thing that, at least most women in their lifetime who would experience one episode or more of miscarriages, and it's a topic that is most times just swept underneath the carpet. You get told things like, as a woman, when you have a miscarriage, you get told things like, oh, don't worry, you have another one. Oh, don't worry, you have another one. Oh, these things happen. But nobody really takes the time to sort of understand what the woman is actually going through who has just had a miscarriage. So I'm going to talk about miscarriages, and I'm going to talk about how to cope when after having a miscarriage. So what's a miscarriage? So for people in the UK, miscarriage is a pregnancy that actually ends before 23 weeks. And in places like Nigeria, it used to be, well, I don't know if I'm up to date, but it used to be pregnancies that end before 28 weeks. So why they do it that way is because in some countries, the age of viability, that's the age where the child can survive outside the womb, it varies in different countries. So while I was still practicing in Nigeria, it was 28 weeks for for a pregnancy, the baby to be able to survive outside the womb. And then in the UK, I think it's about 23 weeks or thereabout. So um most times, most of the miscarriages will happen in the first trimester. So what's the first trimester? Is the first 3 months of pregnancy, and most of the miscarriages happen in, a higher percentage of miscarriages happen in the first, within that period. And so what are the things that could actually cause miscarriages that early? Number one is, in fact, the most common one is genetic abnormality. So what it just means is that the baby is not forming well, therefore the body gets rid of the baby. Okay. Now, women who have miscarriages in their first trimester, I think they are often overlooked because everybody just feels, oh, after all, it has not yet formed into a baby now. So please just get over it immediately. I feel like that's the wrong approach to you know somebody losing their pregnancy in the first 3 months. I think is a wrong approach because the woman or the mom has already started forming a bond with this child. So from the what people don't understand is that from the first time you have a positive pregnancy test as a woman, you start forming a bond with that child. And so even if the baby you lose the baby in maybe the next 2 or 3 weeks, it's still going to have an impact on your health. It's still going to make you feel bad. It's still going to make you feel depressed. So I said the first trimester, the commonest cause of miscarriage is genetic abnormalities. That is, the baby is not forming well. Then when you go on to the second trimester, now the second trimester is the second 3 months of pregnancy. Okay, so after the first 3 months, first trimester, second 3 months, second trimester. So in this, kind of miscarriages that go on, baby is already really formed, especially women who have miscarriages in their the late second trimester. That's almost entering the third trimester, and most times they would have what we call like preterm labor. So they go into labor, so you have abdominal pain, cramping, bleeding, the full labor, like the full labor pains and all those things that you can have. And for some women, they will have to be induced. So what that means is just giving them like a oxytocin. So that's a medication that they use to induce labor, that helps the woman to go into labor and then be able to, like deliver the baby. Now, what are the things that cause miscarriage in the second trimester? So things like cervical incompetence. What that means is that the neck of the womb is not able to hold the baby in, okay, because as the baby grows bigger, the baby is beginning to push on the neck of the womb, and that's if somebody who has cervical incompetence, that the neck of the womb is just going to slip open, and it's going to trigger labor, and the woman is going to labor. The woman is going to go into labor. So The thing about having cervical incompetence is that there is a trick to it. So if you've been diagnosed with cervical incompetence, okay, what that happens is what how that happens, sorry, is that if you've had one or two late second trimester miscarriages, then there's a possibility that you may have cervical incompetence. Now they're going to do scans while you're pregnant and look at the cervix, which is just the big thing for the neck of the womb. Look at it, and there are some changes that they will see that will make them know that okay, this woman has a an incompetent cervix. So how do they treat it? What your doctor would do, this is going to be done by a skilled obstetrician. What they'll do is that they're going to put a stitch at the neck of your womb, that's the cervix, and then close it up with a stitch so that the baby stays in there until 37 weeks. Then they take out the stitch. Okay, that's usually what is done. So yes, so one of the, like I said, one of the causes of late second trimester miscarriage is cervical incompetence, number one. Number two, things like infection. If you've got infection that you don't know about, like things like a UTI, in the urine infection, things like bacterial vaginosis, those things can actually trigger preterm labor, and then it might lead to pregnancy loss because the baby is too young to sort of survive outside the womb. And even if baby, sometimes even if baby goes into incubator, the problems with preterm babies is that their body cannot actually fight infections, and if they get an infection while in the neonatal intensive care unit, it might lead to death. So it's always best to do all you can to make sure that baby stays in there till then. So things like infection, bacterial vaginosis, people have even malaria can actually cause a woman to go into preterm labor. Things like cytomegalovirus. There's a big list of them, but just know that there are certain infections that can actually make a woman to go into preterm labor and could eventually lead to pregnancy loss in the second trimester. There are also some things, some lifestyle things like smoking, excessive intake of alcohol, excessive intake of caffeine too can actually trigger labor. There are some things too when you eat certain foods, food poisoning, some things you eat that will now make you have diarrhea, all those kind of things can actually lead to preterm labor, which can actually lead to a miscarriage, second trimester miscarriage. Okay. So these are some of the things that could happen. I've said infection, I've said, incompetence. Then there are some things that could actually lead to miscarriage too. Things in the womb like fibroid. If somebody's got a fibroid that is really big, some women have fibroids that are even as big as a baby. So that could actually trigger preterm labor and could actually lead to miscarriage. Now, some of these things that I've mentioned in the second trimester can actually happen in the third trimester, which is the last phase of pregnancy. Okay, so the last 3 months of pregnancy. So still the same thing. A urinary tract infection can lead to the woman going into labor, preterm labor. That's before 37 weeks. Any labor that comes before 37 weeks is called a preterm labor. So things like that can cause if she undergoes things like trauma. Let's say she sleeps and she falls down, like sleeps on the tiles or something and falls down and hits her tummy. There's something called placenta abruption. So what that means is that the placenta separates, from the womb, and that could cause a problem. Things like that. So these are some of the things that could happen that could actually lead to pregnancy loss. Now, let's talk about how to cope when you've had a pregnancy loss. Number one is that you're allowed to cry. You're allowed to be vulnerable. You're allowed to cry. It's your child that you have lost. So you're allowed to mourn that child. In places like the UK, they would actually offer you, if you want to do like an actual burial for the baby, if that would help you to heal. There are also postpartum loss, like there's therapy offered for postpartum loss where you go and speak to somebody about how you feel, and that would help. Now, if you don't want to go through the therapy, if you've got support like your friends, like your doctors, like your spouse, if you're married, that you could talk to and you could air out how you feel. So do not be afraid to be vulnerable that period. And then to the people that are listening to me, if you know somebody that has lost a pregnancy, you don't go telling them, oh, you have another one. Yes, they know they're going to have another one, but they are mourning the one that they've just lost. Okay. So I think as if you're close to somebody who has just lost a pregnancy, it will be good for you to lend a listening ear to this person. Just sit down and allow them to air how they feel, and you comfort them, you console them, you tell them that yes, it has happened, but if there are no causes for it, some of the, well, in some cases there's no cause found for the miscarriage or the loss of pregnancy. You can console them, get them, encourage them that the next time they get pregnant to go and register early enough for the antenatal, and so that they will be cared for and then they'll be followed up, by their doctors and things like that. Another thing is to, okay, even if you lost the pregnancy, it is, it's a very devastating thing that would happen to you. You feel like a failure. You feel like your body has failed you. You feel like the system has failed you, which is the healthcare system. You feel like maybe your doctors would have picked up the problem earlier on. Your body has failed you. Everything has failed you, and you might, if you're not careful, you might actually plunge into depression. Now, if you go into depression, what that does is that when you're not stable in your mind, it will cause some sort of it causes some sort of imbalances in your body and might even make it even difficult for you to conceive again. Because I've met some women who have said that lost their pregnancy and they had a hard time getting over it, and because of that, it took them a longer time to actually even conceive again. So what I want to just chip in here is that this you most women will be tempted to want to go out there and start trying to conceive, but I feel it's best for you to try to conceive when you feel like you are mentally there. Okay, you're mentally and you're physically there, because for people who are having things like people who are having miscarriage, especially second and third trimester, so there are things that you're going to have to deal with if you've lost the pregnancy in the second trimester, third trimester. So things like lactation, yes. By that time, your body has already started, trying to produce milk in anticipation for the baby that you're going to have. So even when you lose that baby, you're going to still end up having engorgement and all those things. So you need to take care of those things, manage those things. So things like wearing, tightly fitted bras just to help, relieve the engorgement and things like that will actually help you cope with the period. And I think it's usually more painful for mothers when they see that they are lactating, but there's no baby to feed, or they've already gone shopping, bought things for the babies, and then you go to the hospital and you go back home without a baby in your hand. You feel ashamed, you feel like you're naked. That's how you feel. You feel ashamed, you feel naked, you feel like your body has failed you, the system has failed you. But I just want to say that your head, you're seen, and you're strong, and you will get over this, you would recover from it, and you go on to have even more children. Now, I just want to chip in here that for women who have been having recurrent miscarriages in their first trimester, if you have more than three miscarriages in your first trimester, you would need for the baby to have genetic testing, and for yourself and your partner to have genetic testing. What that means is that you would have to be tested to see if there's any genetic abnormality in yourself and your partner. That's if they find any in the child that you had, that you lost. It's called karyotyping. These are some of the things that they do, doctors will do to sort of help. And some of the tests that they would carry out on women would be things like ultrasound scans, if there's reason to have that. So ultrasound scans, some blood tests to check for infections and all those things. These things are tests that they would do if they feel like you are coming down with symptoms of miscarriages, such as cramping, and that's you're having abdominal cramp, tummy cramp, and that way like your womb is contracting, and then you're beginning to see that you're spotting your passing blood. So if you have any of these symptoms, you're a pregnant person and you're watching me now, or you're not pregnant but you're planning to be pregnant, these are some of the things that you should take note of. Sometimes in the first trimester you can get cramping and slight spotting. That's something we call implantation bleed. Okay, but if you start having this bleeding and it's becoming worrisome, as I say, it's increasing and the cramping is getting worse, you need to contact your doctor ASAP, ASAP, very, very urgently, because it could be that you're having a miscarriage. So you shouldn't take these things lightly. I will stop here on today's episode, because miscarriage is a well, I say it's a very broad topic, it's a very big topic, but I've tried as much as I can to sort of compress it down, to just a few minutes video. And I hope this video has been helpful. If you're out there and you're listening to me as a lady, if you've had a miscarriage before, I just want to say, I wish you all the best. Okay, you're not alone. You know how you feel. It's a sad thing to actually lose a pregnancy, especially if it's one that you actually really wanted to keep. But you can always find solace in in your family, in your friends, in your doctors, and also you could actually seek therapy, and help after losing a pregnancy. I hope this episode was very informative, and if you have any questions, feel free to drop your comments in the comment section. I want you to like this video. I want you to share it so that we can get more subscribers and we can grow this community. Thank you very much. See you next time. Until then, take care and remember to live healthy. Thank you.